Okay, we'll call the meeting to order. This is a Board of Trustees of Perry County Memorial Hospital with the commissioners, and welcome them to our meeting. This is a working meeting between the two groups, so there will be no questions from the audience. First of all, we have passed out an agenda, and is there any changes to the agenda? If not, I need a motion to accept the agenda as presented.
So moved. Second.
Okay, all those in favor say aye.
Aye.
All opposed? Okay, the first item on the agenda is the 2025 financial summary. Ms. Megan Hanks, the Director of Finance, will do that for us.
Okay, like JV said, my name is Megan Hanks. I'm the Director of Finance here at the hospital. What I have up here right now, we have the 2025, 2024, and an average of the 3-year prior. I thought that was a good picture of where we were and where we're at now. On the left-hand side there, we have just a snippet of an income statement, and on the right, we have some statistics just to kind of match up to what I'm talking about. So for 2025, our total gross revenue came in at just over $162 million. Our deductions were right around $105 million, leaving our net revenue at $56.5 million. Overall, our net revenue decreased about 1% from the previous year. Our largest fluctuation has been with our inpatient. When we looked at it, our inpatient decreased about 9% overall from the year before. It was an ongoing trend, swing bed in particular, across all hospitals that we were looking at. Our inpatient admissions dropped 40 patients into 2025, but that offset kind of was picked up with our observation. Observation change doesn't get paid as well as inpatient. So I think some of our insurance rules had changed last year to prevent more inpatient admissions. Deductions, I just wanted to point out that overall our insurance deductions decreased about 1% along with our patient revenue. But our largest increase was across our financial assistance program and our bad debt program. That overall decrease was, or increase, I'm sorry, was about 12%. And overall, it's a 55% increase from that average till now. Moving on into our expenses, we ended 2025 just shy of $57 million in expense. I just wanted to touch on a couple of things going through there. Our salary and wage plus our benefits increased about 13% from the prior year. We did add some new departments this year. We added a Renewed Horizons, our Main Street Clinic, and our police department. But our larger increase was due to our claims expense. In 2025, we had about $2.4 million more paid out in claims expense than 2024. That did lead us to changing our insurance policy program this year. So far through the end of May, we have saved around $785,000 due to that switch. Some other highlights I wanted to bring up, we had some decreases in our agency staffing for nurses. Kayla and her group did really well with hiring in 2025. We did increase some agency staffing in our lab though. We hired some new med techs, but that increase has brought in a ton more tests being performed. Over the last 12 months since we hired our first med tech, we've had 6 of the top 10 months lab has ever had. So, and 4 of the 6 have happened this year. We've really picked up in that department because of that. We had a couple other things pop up this year that we weren't expecting. We had to replace a data closet UPS, which is a power supply. It keeps everything going between us losing power and our generators kicking in. So it's extremely important for upstairs and our other patient care areas. We've also added 3 new telemed lines, including neurology, endocrinology, and rheumatology, which increased our expense that we weren't expecting. Go to the next slide, please. So overall, I wanted to bring up our some of our highlights from our balance sheet. Our total cash and investments are at $23 million. You can see over the past several years how our cash has kind of changed categories. We had a lot of cash in the bank before. We've shifted that. 2024 was a big year for CDs for us with some of those interest rates dropping in 2025, they decided to move them into investments. I looked this morning, and as of today, we've only lost money on our investments 1 month out of the last 12. And the month after that, we had made that money up and then some. So we've done really well with our investments the past year. Wanted to bring up our total AR. For hospital and clinics, we're at $17.3 million. We do have to have an allowance in there, so we don't expect to receive that full $17.3 million. So our net AR, which is what we do expect to receive, is about $4.6 million at the end of the year. Looking through this, part of this was due to our less gross revenue. The business office has really worked to reduce their net AR days. That's working to collect money and post money faster. So our net AR days have actually dropped from 39 just to over 30 in the year. And lastly, I had our days cash on hand. That's a big one that we look at every month. At the end of the year, we were at 166.4 days. So our CFO, Randy, had sent me some information about this. We get a report every year that compares us to the rest of Indiana as far as critical access hospitals. It compares us to our region, which is most of the Midwest, and then the US as a whole. I found it interesting. This was from 2024 data, but out of the 33 critical access hospitals in Indiana, our days cash on hand is 166.4, and the median for Indiana is 24.3 days. The highest was in our region. That average is 111, and then across the US, that median is 99 days. So we're exceeding all of those benchmarks. And then I have included, if you go to the next slide, please. I just wanted to give a representation. This is the last 3 years of our gross patient revenue. You can see that it is up and down all the time. It is a constant. It varies every single month. It's not uncommon for that to happen. But if you go to the next slide, Nick, this is our cash. So this is our cash and investments. You do see some dips just specifically in January and July, which is when we make our hospital payments. But overall, that's been pretty consistent over the last 3 years. So I just wanted to share that with everybody as well. And that's what I have. Anybody have any questions?
Thank you, Megan. Nick?
So I'm Nick Harley. I'm the CEO of the hospital, for those that don't know me or haven't met me. Some information I'm going to share is just about our strategic goals that we've had over in 2025, and then some of the priorities we're working on in 2026. So typically our first 3 goals are shared goals amongst all of our hospital staff and health system staff. They typically are around finances, patient satisfaction, and some sort of community or hospital engagement goal. So our first goal was to improve admin communication with employees by achieving 55% attendance for all CEO-led quarterly town hall meetings. So this is where Jared previously had given town hall forums, and we wanted our staff to take part in that. So we wanted them to come in person so they could hear, the information being shared. And we did achieve that goal at 60%. Our goal was at 55%. Then, of course, there's always a patient satisfaction goal, as I mentioned, and the measure that we used last year was to achieve overall would recommend score. That's a pretty standard question that I'm sure most of you have had on your patient surveys in the past, and shared across most hospitals. So NRC is a company that conducts our patient experience surveys, and our goal was 74%. We look at what the industry standard is, what we're compared to with other hospitals that are in the NRC database. So we set our goal just slightly above that. We did achieve that with 84.5% score for overall would recommend. So we did really well with that. So we did shift our goal a little bit in 2026 to responsiveness. That's something that we wanted to work on this year as a priority. So that goal changed just a bit. Goal 3 was to achieve system operating margin. As Megan just mentioned, we did show a loss of operations of $386,000 for the year. Mostly is the stuff she mentioned, decrease in our contractuals, increase in our contractuals. And but we did have an income overall with our non-operating income at $1.4 million, which led to a total income of $1 million for 2025. We always have a goal to grow our service lines, so that was a big goal for us last year. We wanted to add 3 additional service lines, and we did that. We added telehealth rheumatology, endocrinology, we added a bone health clinic, and also the renewed Horizons Jerry Psych program. So we're also looking at ways always to establish or improve community relations. So we want to try to be involved with the community as much as we can. So we made it a focus of one of our goals. We focused on some of the schools in our communities that we serve, meeting with Tell City High School, Hancock County High School, to discuss different student programs that we may be able to assist in for those interested in careers in healthcare. We also met with ATTC. We do a lot of work with them. We looked at ways to expand that work, always looking at that. And also some discussions with Holiday World with some resources and some opportunities for collaboration. And that's still an ongoing discussion that we're having currently. Always looking to grow providers and recruit physicians. That's always going to be a goal for us. We're always going to focus on especially family medicine, primary care, physician recruitment. So that's a goal for this year too. We did have a family medicine physician that signed last year, but in the end it didn't end up working out. So we continue to recruit family medicine physicians. We did sign additional APPs for women's health and bone health clinic in the past year. That's advanced practice providers, typically nurse practitioners, PAs, that kind of thing. Then everybody's aware of all the AI that's going on. So we wanted, it's affecting healthcare too. So this past year we did add Suki AI documentation assistant software for our physicians and our clinicians in our clinics. And we also, with our new CT machine that we just utilized, it's the latest that we installed last year. It's the latest and greatest on the market, and it utilizes AI to produce clear images, so it can help adjust the patient, that kind of thing, to produce clear images. And all the feedback that we get from the radiologists reading our images is that they are second to none, so we're happy with that. Some priorities that we're working on that we continue to work on into 2026 is, of course, physician recruitment, as I mentioned, family medicine. We have started working closely with the family medicine residency program at Deaconess Memorial in Jasper. We actually have some interviews set up with with one of their residents actually. So we want to collaborate with the programs that are more local to us, for especially those physicians and residents that want to try to stay local within the region. So that's an opportunity that we're trying to explore more with them. So, and then with orthopedics, we have recruited an orthopedic surgeon to be full-time that will cover all orthopedic conditions. And he will be starting October 1st. So we're excited to get full-time orthopedics here. Other priorities that we worked on or have completed this year, you'll be seeing communication come out that we will be extending the hours of our quick care clinic to 7-day-week operation. We have started our pain management clinic on June 10th with a physician and an APP model. And that physician he actually starts in this July, and he'll begin doing procedures here at our hospital. We did expand our wound care provider, wound care coverage with an additional advanced practice professional as well. And we have created a prior authorization department. So a lot of those PAs that are required for that hospitals have to do for procedures, radiology, imaging, that kind of thing. We centralize that into one department now to help improve. And obviously our goal is to decrease those write-offs and contractuals that hit our income statement that we talk about so much. And then the big project that we're working on right now, we have kicked off our Epic EMR discovery and implementation plan. So we will be moving to the Epic EMR platform. And we're in early stages of that currently in discovery and looking at hardware installation, things that we may need to not necessarily fix, but build up to put Epic on top of. So very early in that stage, but we're excited to get Epic implemented and become part of the MyChart family too. So. All right, that's an overview of our strategic initiatives now and what we've done last year. So, commissioners have any questions or anything? Certainly happy to discuss them.
I always have a question. So if I wrote this note down correctly, you experienced a $2.4 million additional loss on your healthcare benefits in addition to what you did the previous year in '24?
Yes.
Is there
Yeah,
any?
our claims expense were $2.4 million higher in 2025 than 2024.
And what was the primary cause? I mean, your staff had a big turnover. Did you identify what caused that kind of?
Being a self-insured program that was, if you have a few utilizers of healthcare that may have a cancer condition or whatever the case may be, that can be really expensive, all that hits. So
You got an 80 or 85,000, is the part that you pay, then you have reinsurance, don't you?
We do.
we did, and we took that to the market as well, previously, to try to get that quoted for us so that we could have that insurance for insurance essentially. And they took it to 30, our brokers took it to 32 different organizations. They all declined.
To provide you reinsurance?
Yes, because of the expense.
So the county doesn't, we self-insure to 60,000. So that's similar.
Yeah.
But we've not been turned down on reinsurance. And we even got some of our, what do they call it, Kelly? The ones where we have the high cost ones, lasers.
Lasered out.
Removed from us. So it's through a different provider, but where you have about 250, 300 employees that you're covering in that range.
Yes.
I'm just thinking, because I know your old benefit package was in the $6 million range. And that was, I'm assuming, included all benefits with healthcare. And then you increased it to $2.4 million in 1 year. That's a lot. If you, are you an 80,000 or 85 on self-insurance? Or did you not have reinsurance last year in 25 at all, where you had to bear the 100% of the burden?
We had some, I don't know what our reinsurance rate is, so.
I don't know what it is off the top of my head either. I'd have to go back and look at that, but we bear most of the burden from that. And it was a pretty rich insurance plan that we had for healthcare, for what our brokers are telling us, that kind of thing, for any industry really. So, that's what we had to look at other options, this year, because the expense just kept going up and going up, and, there was no one in sight, which, isn't just secluded to us, everybody's feeling that, but.
So can an employee here at the hospital have any procedure done at the hospital for free? Is that, you hear all kinds of stories, and I just trying to clarify, is that true?
Not of today, so we have an ICHRA plan model now, and
Back in 25, was it true though?
essentially, yes.
And did that include the Deaconess Network?
Yes,
So anywhere within not only Perry County, but Deaconess, you could have free healthcare.
correct.
To an extent.
So before this, you didn't include Deaconess. When did that kick in your network?
I think it was 2025. They were still on a higher tier in 2024, which covered more, but 2025 was whenever they were included in the same
When
tier.
Deaconess was included in the basically free coverage for any employee or their family. Okay. Then I noticed, then you said now 700,000 in that range is what you've actually saved.
785
Okay. Compared to 24,
compared to 25.
25.
So in
So-
5 months of this year, that's how much our insurance benefits have reduced, 785,000.
So in essence, if we look at that as 1.5 million or something in that range, you're still going to be 900,000 in that range higher than what you were in 24 for those health benefits.
Probably close.
Yeah, but there's a lag though, right? So you lag in Q1 from the previous plan. So I think if you're looking to baseline like an annual spend, it'd probably be better to do that next year so there's no lag.
True.
But you're looking at, what are you, maybe 60, 90 days?
Hopefully, yeah.
There was a huge chunk of claims from 2024 that were reprocessed in 2025 too.
That's true.
And I can't remember what Kayla had that number at, but I want to say it
That
was
were
around
carried
7.
over.
Yeah. We were not expecting in 2025, but the insurance company reprocessed them.
So who does your administrative work? Is it Anthem?
No, we have.
Process your claims. You've got to have somebody that's doing
It
that.
was SIHO.
I'm not familiar with that. Then, so you're still burning some cash here. I looked at your cash investments here just for this. And it looks to me like you burn about $4 million in cash investments between 24 and 25. Did you have major purchases that you utilized that? Or?
Health insurance benefits was probably the biggest one.
So were the health, this is actual cash that you had over for investing. You had 27 million in 24 and 23 million in 25. I thought you used you had what, 385,000 or something in that range that you lost actually on operations, and 300 and some, I can't remember the number. And then if you plowed back in your investment income, you actually would have shown a profit. But if I look at your investment asset value here, it's $4 million less. I'm just curious as to what happened. It went from 27 to 23.
I don't have it in front of me, Randy.
I was just thinking if you bought something big and expensive, that would
Just
answer.
say our capital purchases were just shy of $3 million last year.
But I mean, over and above the year before that, what was the comparison?
To find it. Sorry.
That's okay. I don't have all my questions just by looking at these. I'm just curious as to when I look at these numbers.
Our capital expense in 24 was about 1.8 million.
So
we
in other
did-
words, about $1.2 million you additional capital expenditures, that would be part of it.
Yeah, you take the 1.2 out of capital and then add back in the 2.4 over budget for benefits, and you're getting to around 3 million.
I'm sure it's in our audited financial statements from Blue and Company that we can get Randy. He'll explain that.
But see, but you were profitable in 24. And you may take it out of your investment to pay your additional loss. But that means your profit dropped also. Because you actually made, I can't remember the number, maybe 3 million in 24. So if you're gonna say you took your 2.4 out of your cash sitting here on the sidelines, then your operating income suffered $2.4, $2.6 million difference. So something happened there, either or. And I don't know if you had certain segments dropped off or whether that's where that came from. And I don't mean to put you on the spot. Don't, this is just what I'm observing here on going through this.
I'll be able to give the copy of the audited financials.
Yeah.
We should take that action.
Right. That's what I asked him earlier. I've got copies for some previous years and it's helpful just to use those for comparison purposes to try to identify areas of concern.
Yeah, it's like a 60-page, pretty robust.
Then you made a mention that you had some of your investments that you lost money in. Just curious, what's a typical investment the hospital makes? Is it CDs? Is it treasuries? Are you buying stocks? I'm trying to understand where the loss would come, what kind of risks the hospital is actually taking with their investments.
We had $12 million that we decided to invest, and we gave it to 4 investment firms here in Tulsa City. John Shear,
Old National. German American, and Onyx Financial.
Yeah, the Onyx Financial. And we gave them that money and we told them to invest it. And like Megan said, we made money every month, but 1 month, and then the following month, it covered the loss for that 1 month.
So is there any restrictions on what they can invest in
Yes.
and such as?
Well, so many, there's a percentage in stocks, percentage in bonds, percentage in cash, and,
So you establish how much could be invested in each category,
correct.
but no stipulations on the quality of the stock, bonds or anything?
Well, pardon me?
I believe that's in there as well.
That's
It
in
has
there
to be
too.
a certain grade.
And it eliminates like alternative assets. It's like the investment committee put together some guidelines and run rules so that these financial advisors operate under the premise of those run rules from like a risk standpoint.
And then you mentioned the Epic, and then you also, was it Suki that you have the AI?
Correct.
So are those two gonna play well together?
They can, but Epic also has some preferred vendors that they use for documentation assistance. So I'm sure as we explore this further along, we'll look at potential of those two and costs associated with those, that kind of thing, so.
But the question is trying to get on a consistent platform so that, you know, there's not administrative needs in between you to try. Because anytime you get somebody's fingers involved with it, then you can create errors. So that was my
Yeah,
concern.
most of these EMRs, large EMRs, Athena, Epic, MedHost have preferred vendors they like to work with for documentation assistance. So, you know, they all have their preference out there. Now, whether you use those or not, you know, it could be, maybe, you know, your decision, sometimes not, but, you know, that's why we'll look at those and explore and see what's, you know, right for us and our physicians.
Okay, so then, are you taking historical data, putting it into Epic also?
We
Or how
will,
does this, you will do that? It's a process that you,
it's a process, yeah.
and then how many years do you go back? So I'm just curious with that.
I don't know the answer to that off the top of my head, how many years I go back. Typically you do, you know, so many visits. You know, we do have to maintain records, you know, according with policy, for years, regardless if all of that gets uploaded into Epic and that kind of thing, because, I mean, at some point you will be able to upload everything probably into Epic, but probably the last few visits, that kind of thing. But I don't know off the top of my
Yeah,
head.
I'm just saying, if I understand Epic correctly, your electronic records follow you to any other participating hospital.
Yes,
I think it's critical to know that a heart patient 10 years ago had a specific condition and was treated, the outcome, and so that that next vendor is well aware of what actually occurred. And I'm thinking, how far does that go back and how much does that involve to get all that historical information into the system, you know, so it serves that purpose? Just a question of mine.
and typically, you know, if you have that history, that kind of thing, that should be in your physician's notes too, regardless if it's, you know, recent visits and stuff like that as well.
And some of our physicians have paper.
Some do.
And that's difficult then to get, I mean, it just takes a lot of time and effort.
Yeah, it does, you know, regardless of what record system you have, you know, you say they're paperless, but they're not always paperless, so there's some, you know, stuff you gotta put into them, but.
And I got one last question, unless somebody's got a question for me. I noticed you guys had a meeting on this Epic, and I'm assuming you approved going forward with that at your meeting. But I noticed you had an executive meeting and then another executive meeting. How is this relationship with the hospital and I think it's Tell City Management or something to that nature? How's that structured? How's that work?
Yeah, so Tell City Management meets quarterly, and we have to have that in place for the affiliation to work, so that it shows that Deaconess has that controlling interest in the hospital, so that we can allocate expenses on the cost report. Helps our Medicare. I don't know if you remember that presentation from 3 years ago.
Right. It's whenever you were doing the home office allocation.
Yeah, so as Deaconess members, we're not on the hospital board, we're on the Tell City Management board. So it gives us that opportunity
Okay,
to show
so
that.
so who's on, Does Tell City Management then, is that who interacts with Deaconess? Is that how that
Yeah.
works? And then so that the hospital is actually not, it's working with Tell City Management, not Deaconess?
Right.
Okay, so who's on the Tell City Management group?
It's the same board, it just adds the 2 Deaconess members.
Okay, so it's the existing board plus 2 Deaconess people. Okay. And then how, now that you brought that up, the home office allocation, how is that accounted for on one of these documents?
It's not, it's just on the cost report, so you won't see it on the income statement.
So you won't see it.
There's no
on-
dollars changing hands.
So how do you arrive at the savings there? How does that? You compare it to historical
Long
data?
story, but it's how critical access hospital is reimbursed by Medicare. So Medicare reimburses based on our expenses. So being affiliated with a system like Deaconess, we can say instead of our expenses being 50 million a year, we take 1/10 of Deaconess's, whatever they spread it among their hospitals. So our expenses are now 55 million. So Medicare pays us more because we can show more expenses on our cost report. But it's not on the income statement. It's just a cost report submitted to Medicare.
But that, doesn't that impact your income that you make on every Medicare, Medicaid patient?
Yeah,
So that would
just
actually
Medicare.
elevate that revenue source,
Correct.
right?
Yeah, just Medicare.
Just Medicare, not Medicaid.
Right.
And then I guess you're basing it on what it would have been without that, that money being dumped over the.
Yeah, so you just take your cost report and then pull it out and say this is what your Medicare payment would be if you didn't have it.
So I remember, now you're taking me back again. I don't remember, was it 24 that you eliminated OBGYN? The baby delivery?
Yes,
Right, I think at that time you had saved $2 million.
that was the plan, yeah.
Did that occur?
Yeah, because it was what we had expensed in 2023 was $2 million for
And you just
OB.
eliminated those expenses?
Yeah.
But wouldn't that have been a reoccurring savings?
It would be, yeah, going forward.
Right.
Yeah.
So in other words, because that's 2 million, and I'm just getting back to the point that it still appears like the hospital had a loss in operating expenses. And if we save 2 million on the baby program and we spend another 2.4 million, I'm looking for offsetting dollars, and then we've taken money out of the savings account, and we're not making as much money, and I'm just curious as to what, something seems like it's a little skewed. I'm just a little confused with that.
Yeah, I think if you look at our audited financials and our statistics, I think you'll be able to see where our volumes have dropped and the revenues have dropped because of that. I can't speak to it off the top of my head without seeing them.
But
I'm sure we'll
whenever,
get that to you.
so in other words, you went through those things that you're targeting.
Mhm.
Do you have like a plan that says, I'm gonna initiate this specific service, my intention is to get 250 people in the door. I'm gonna generate X number of dollars as a base,
We do. We have
and then you grade yourself according to hitting that plan? Because I can see I see this a lot of times, that people have an idea, but they don't drill down to specifics. And then at the end of the year, in order to feel good, they adjust what their outcome is. And I think we have to take a cold, hard look at what we're doing and seeing whether, just as Jared did with the babies, it just didn't make any sense for us to try to maintain a program like that in a small rural hospital to keep it staffed properly. Even though a lot of people liked it, it's just one of those things that it's really, really difficult to do. So that's my question, as you take these initiatives so that you have test yourself back against that.
Yeah, we do like a pro forma, like a workup, like for the orthopedic program. Bringing an orthopedic surgeon here would increase our volume. Right now, we have a part-time program essentially. But having our own full-time program would obviously bring more patients in the door, more surgeons in our OR, more patients in our swing bed program, because you're gonna have more hips, more knees, more of that. So all those things we're looking at to help increase, just not patients seen in the clinic, but in our hospital, in our swing bed, in our OR. So yes.
That's all I can think of right now.
a lot. I appreciate the information.
You're welcome.
When we, for the audited information, could we get the 24 and 25, just so I have a comparison then?
Yeah, they're in the same,
They do.
2025s will have 2024.
Thank you. That's all I have.
Okay. We will close our meeting, and then you have to do something special to close yours.
We never opened ours.
Yeah, so we'll just go,
Okay.
you invited us.
All right, okay. All right, no more questions, need a motion to adjourn the session.
So,
All those in favor say aye.
uh,
All opposed? Thank you, folks.
Thank you.
Thank you.
Yeah.